As more of America's cities are seeing an increase in coronavirus cases, a troubling new dynamic has emerged. Communities of color are often the hardest hit with the worst health outcomes.
I would imagine pre-COVID, if someone had asked, what do you think the demographic outcomes will be as a result of COVID, people could just guess.
For example, in Boston, where African Americans make up only 20 to 22% of the population, they represent 40% of those diagnosed with COVID-19.
It's all about systemic racism. Black people and people of color are more likely to have asthma. They're more likely to have diabetes, cardiovascular disease. These are the risk factors that make you more likely to have more complications from COVID.
You know, it's really no surprise. It's all rooted in the exact same thing, which happened a really, really long time ago when people were relegated to certain communities. When you have communities like that have been disinvested in, the majority of the people in those categories are people of color, also people who are immigrants as well. And so when you have lower income, you will have worse health status.
People may live in multi-generational families. They may not have the opportunities to practice social distancing in the ways that we are recommending. In addition to that, people may, due to economic reasons and stress, need to continue going to work, being on the front lines, exposing themselves to potential illness.
While there are certainly hurdles, the COVID-19 public health emergency has revealed barriers can be broken and change is possible.
We need to diversify the healthcare system so that patients will be more trusting with our recommendations, and then also so that the staff will feel more comfortable with the patients that we care for.
And what I'm hoping is that COVID would remind us of the importance of public health and investing in public health. And now that we've seen the impact that it's had disproportionately on patients of color, when we roll out those new interventions, we really need to make sure that we get them to the people who may not have had access to all these interventions.
The only way it can ever get changed is for us to change it. If we can shift our mindset a bit to the extent we're able to, and to prioritize and say, this is what we want to do. We want this to be a never event, then we can do that.